David Levine. I'm co-chairman of Science Writers in New York. This is one of our many interviews on COVID-19 that we're doing. My producer, who's in the background, not being seen, is Joe Bonner, who's my co-chair. I'm very pleased to have three great journalists who two of them I met in person, Eva Wolfangel, Malin Attefall, and Yves Sciama. So I'm going to let them introduce themselves, and so please unmute yourself so you can talk. Malin, why don't you go first?
I think some of you already met me on the last webinar you had. My name is Malin Attefall, and I'm a science journalist by training. I've been working with the news for the last few months, since they do have some need for people that know science to report on COVID-19. So that's what I've been doing. Today I reported on a story on the deaths in Sweden. We got the first 6 months numbers for today, and it seems like we never had such a high death rate for many years as we had this year. So that was my big story today. Usually I work for a science program on television, covering more general science stories, such as space and medicine and things like that, and the Nobel Prizes, of course. But right now I'm a COVID reporter full-time. That's it.
And so Swedish Public TV, correct?
Yes.
Okay. Eva?
Hi, everybody. I'm a freelance science and tech journalist from Germany. I write a lot about artificial intelligence, virtual reality, computer science in general, robots, cybersecurity, and things like that. Right now, of course, COVID is something that is in my reporting as well. So I did something about how AI can help us to fight the pandemic. I'm researching retrospective contact tracing right now. So the question, how much would it help to do contact tracing retrospective, asking, finding out who infected someone, because then you have someone who for sure is infectious, because most of the people, as we know, are not infectious. Only 20% do infect others. I write and research a lot about data protection and privacy, which was a big topic around our contact tracing app. I think you have similar discussions in the US, which is quite interesting. And a big topic as well for me is conferencing in times of COVID, so things we are doing here. I love VR, virtual reality, as a solution, and I did some experiments and projects on that. And I hope that next time we can meet either in real life or maybe in virtual reality.
Yeah, you and I met in Heidelberg. So
Heidelberg we had some VR in Heidelberg as well, right?
Yeah, yes, you did, yeah.
It was nice. And on Zoom, of course.
Yeah. Yves?
Hi, everyone. So I'm Yves Sciama. I'm a reporter from France. I mostly cover environment and health. And so I do some COVID right now, and a little less environment. Presently, I'm researching a story on the origins of COVID and the different hypotheses, whether it's lab-made or whether it came from farms of small carnivores or whether it jumped directly to humans. I mostly work for Science et Vie, which is a monthly magazine, which is kind of equivalent in readership to New Scientist. But I also write for dailies such as Le Monde. And from time to time, I have a shot at Science Magazine. And besides that, I'm the president of the French Association of Science Journalists, which, contrary to NASW, is a journalist-only association, but in other ways it's similar, although it's much smaller, of course. So right now I'm talking quite a lot in the media about the need for the general media to have more science journalists and to be able to deal with scientific questions in these times of pandemic.
Where in France are you located?
So I'm based close to Grenoble, which is kind of on the southern part of the country.
Okay, so I just wanted to read, so France is under a second national lockdown until at least December 1st. People can leave home to go to work, buy essential goods, seek medical help or exercise for 1 hour a day. Anyone going outside must carry a written statement justifying their journey, which Yves told me is a very French thing. All non-essential shops, restaurants, and bars are shut, but schools and daycare centers are open. Social gatherings are banned. And Paris bars have been closed since mid-October. In Germany is a partial lockdown until November 30th. Social contacts are limited to 2 households with a maximum of 10 people. Cinemas, theaters, gyms, pools, and saunas, restaurants and bars, except for takeaway, are closed. But schools, also daycare centers, shops, and hairdressers are all open. Large events are canceled and fans cannot attend sports events, but church services are permitted. And overnight leisure stays in hotels are banned, and non-essential travel is strongly discouraged. In Sweden, bars and restaurants are to close early from November 20th. All licensed bars and restaurants must stop serving alcohol by 10 o'clock and close by 10:30. And it says that masks in Sweden are still not recommended, but a maximum of 8 people per table can sit together in cafes and restaurants. There are other measures which the government advises, but they're only voluntary. So Malin, why don't we start with you, because you emailed me, said because Sweden has more cases than, Sweden's got a lot of heat, obviously, from the media. You have more cases than your neighboring countries of Finland and Denmark. Your prime minister said that, Interior Minister said that there are new limits on gatherings, far fewer than the 50 allowed during the earlier outbreak, will be in place for 4 weeks, but could be extended to run over the Christmas and New Year's holidays. And he said too many people were acting as if the danger was over. And he said, my advice is, don't go to gyms, don't go to libraries, don't host dinners, cancel everything. So everyone thought that Sweden was adapting a herd immunity strategy, and you disagree with that.
Yes.
Well, not that you don't. So you're not setting policy. Yes, again.
No, I'm not responsible for the policy, but something that kind of annoys me is that I think a lot of people, especially in America, has this view that Sweden are aiming for herd immunity by infecting as many people as possible. And that has never been the Swedish strategy. It will never be the Swedish strategy, and it is not the Swedish strategy. We do not aim for herd immunity. I am not sure where that rumor started, and I'm not sure why Sweden is an example for that all the time, but it is wrong. So that's the first thing that I would like to correct. And when it comes to the rest, we are different from many other countries in Europe. When it comes to the regulations, we're not different in that sense that it's done pretty much in the same way in Sweden, but it's voluntary. That has to do with our legislation. So people are very compliant with the recommendations, but they are not forced. So we do not have a forced lockdown, and you do not have to carry any papers if you leave your house, but you are recommended to work from home if it's possible for you. And you're also recommended not to go to gyms and not to go to restaurants and not to go to shopping centers, but they are not closed. And that has to do with the way our legal system works. So some people go there anyway, but the recommendations from the health authorities and from the government, especially right now, since our numbers are increasing again, not our deaths, but our numbers are increasing right now, is to kind of do the same thing as most of you are already doing. So sometimes Sweden is sort of an example for a let go easy lifestyle in this pandemic. And I would say that is wrong. we take this very seriously. It's just a different way of doing things.
Well, I'll give you some numbers. Sweden's cases per capita are currently 10 times higher than Finland and 4 times higher than Norway. Last week, the rate at which people were being admitted to a hospital was growing faster in Sweden than any other European countries. And your Anders Tegnell, I'm not sure who was the top epidemiologist, said that he admitted that the strategy to fight COVID-19 resulted in too many deaths after persuading his country to avoid a strict lockdown. And he said, if I were to encounter the same illness with the same knowledge, I would do things differently. So,
he was actually falsely quoted in that story.
okay.
Not said that he would have done a different strategy, but of course you have to say that it's a horrible loss when so many lives are lost. When it comes to of course not a part of the Swedish strategy, but sometimes I think there's so many things that people sort of get wrong in this. So I'm trying to explain it, even if I'm not responsible for it. So when it comes to the deaths, we do have high numbers in Sweden, but we are not at the top of the league in a sense. Actually, I did look that up right before, because I know there's something that always comes when we talk about the Swedish strategy, and Sweden is number 6 in the world right now. Belgium has about double as many per million. And then Brazil, after that, Great Britain, then USA, then Italy, and then comes Sweden. So that is a high number, especially when you compare it to the other Nordic countries. And we do have a lot of people looking into what went wrong in the beginning of the pandemic, because our numbers they're not skyrocketing anymore. It was a high number of deaths in April and May, especially. And there's several different explanations for that, but none of us will know until after the pandemic is over why it happened. What I would say, the biggest mistakes we have done in Sweden so far in the pandemic is, one is our elderly care homes. I think a lot of people did not understand how fragile the people that lives in Swedish elderly care homes are. Our life expectancy in Sweden is one of the highest in the world. And the people that lives in Sweden are much older. We are close by to the Japanese. People live for a long time and they're very fragile. We should have kept them as we do in hospital. The people that worked in the elderly care homes should have wore protective face masks, better clothing, visors, things like that. And that was not available because I think that nobody understood how fragile our elderly were. So that was the biggest mistake. The second biggest mistake, I would say, would be the lack of testing in the beginning of the pandemic. That has to do with that the regions in Sweden are sort of independent from the state, and we were not prepared. They were not prepared to test as many as we needed. So when we did get a lot of contamination and a lot of spread of the disease in the beginning, there's no way for us to test everyone that got sick. So it wasn't possible to trace any of the new virus that came in, and that was a big mistake. I think that those two kind of explains, that's what I believe. It's my personal opinion. It's not like a government opinion, but those are the two reasons why Swedish death numbers skyrocketed in the beginning.
Okay, so for the audience, if you have questions, please put them in the Q&A box, and then we'll get to them. Don't put them in the chat box, because that's just for the me and the panelists. And so, Eva, you were going to say something?
Yeah, what I found really interesting, what Malin was saying, is that people comply to rules or to recommendations, and so that maybe it's not necessary to have a strict lockdown. And I think this is especially interesting because now in Germany, I feel like that the atmosphere is shifting, so that people now don't accept the measures that well anymore compared to spring. there was a meeting from the from Angela Merkel with the Landesminister. I didn't learn the right words. So with the whoever, Angela Merkel tried to convince other politicians to have more strict measures now. So her idea was to only allow to meet with one other person or maybe two, and only from the same household every time. So at the moment I can meet with up to 10 people from 2 households, and I can meet every single day or even twice a day. I can meet people from different households. And her idea was to make that much smaller, so that you will only be allowed to meet people from one other household and only the same one, and things like that. And I heard a lot of politicians, even from her own party, complain about that. And of course, many people complain, and they say, wow, now you told us for November we have this lockdown light. And everybody was hoping in December everything goes a bit more back to normal. And now it seems like, no, it will be even stricter in December, and who knows when it ends. So the acceptance is really shrinking. And I wonder if this Swedish approach maybe would help people to be more open towards these recommendations towards our system, because at the moment I feel it doesn't work that well anymore.
How do they
One thing I find interesting.
How do they enforce it? How do they enforce that you only have 10? They're only meeting with other people.
This, I don't know how they would enforce that. Do you think that you only meet one household? I don't know. Maybe you should have to write that down. We never had this before. At the moment, it's up to 10 people. And I think in spring, I was in the US, so I don't know for sure, but it was about 1 or 2 other persons. And this was just police walking around and doing controls.
Okay.
Right?
So is there, but you are under a lockdown. Is there a mask mandate?
It's for if you're inside. In schools, they have to wear masks, but in elementary schools not, but in higher school they have to wear masks. If you go in the supermarket, things like that, not on the streets, only in some areas where you cannot stay away from people. So in shopping streets or areas like that.
So what's the atmosphere like? I mean, you can't go to beer, right? There was no Oktoberfest, you know. So.
No beer, no Christmas markets. All the Christmas markets are canceled, and this is something Germans really like a lot. So yeah, that's it. And I feel these measures work. If people don't go to restaurants anymore, because this being inside with other people is a problem. And of course, it feels, although this is a lockdown light, how they say, it feels like, there's missing a lot.
Okay. Yves, why don't you tell us what's going on where you are?
Yeah, so we have a lockdown which is not so light. It's slightly lighter than it was in April because the schools are open right now. But for the rest, you're just allowed to go to work, as you said. And indeed, you're allowed to go for a walk 1 hour a day, and you have to stay within 1 kilometer of your house. And what's interesting is that, I mean, the discussion about enforcement is really interesting because this is not really enforced. I mean, we don't see the police in this new lockdown the way we saw them in the one before. It's just as if they had sort of stepped back and let people do their thing, probably because they feel there's a rejection of many of these measures. And, you know, in France, there have been social tensions with the Yellow Vests movement before this pandemic. And these tensions between the population and the police were sometimes very strong. So right now we have these very strict rules, but they're not enforced in a very strict manner. So it's
but that could happen.
But it could happen, of course. Yeah. And you know, there's some local wriggling into this. I mean, in some places you will have a local police which will be more active and present. But on the whole, what I discuss with my friends and colleagues is that we don't see policemen anywhere, and we write these papers and we sign them and nobody asks us to see them. So that's a sort of new development. But I mean, on the whole, I would say the population is still pretty compliant. And the news right now is that we're hoping that we have passed the peak because the figures have been going down for a few days. So now we're stepping into this discussion whether does this justify or not to relax the rules or not, or should we sort of keep the rules tight until Christmas at least to sort of bring the figures down. For the moment, the figures are pretty high in France. I mean, I was calculating, we had 350 deaths every day for a population which is 5 times lower than the US. So by US standards, we would be having 1,500 deaths per day, which is not so far from what you have.
No.
So I mean, the situation is pretty bad, and I would say on the whole, people understand it and are trying to be careful. But there is some tiredness with all that.
Okay. So this is a question for, okay, so please put, there's only one question in the Q&A box, so please put questions in. But so I have a question. Besides living in your countries, you're all reporting on COVID, and what is that like? Because I watch all the American journalists, and they look very tired, you know, doing this day in, day out. And I was just wondering, what's your experience been, you know, reporting? I know that some of you are more recent, but what's your experience living, you know, with COVID and also having to report on it? So this is for each of you.
So maybe I can start. Can I start?
Sure. Yeah.
What I would like to say is that it's pretty tiring, but what's really hard to put up with is the very high level of denial that we're seeing right now. I mean, working a lot and explaining what's going on is one thing, but right now in France, we have a lot of denial of the pandemic. And although, you know, the emergency wards are full and the beds are full, and we have reports on TV every night of the situation in the hospitals, there are still many people, including doctors, saying, oh, this is overblown. And this is still not very different from the flu. And we also have this huge discussion about hydroxychloroquine, which has not died down. And this doctor who promoted it, Didier Raoult, has become a sort of prophet. And it's really impressive. It's worse than religious. I mean, you can buy medallions on the internet with this guy's face on them and wear them as a necklace, you know. So we have a small part of the population which really believes much more strongly than we ever saw conspiracy theories and things like that. And there's a sort of disbelief in science, medical expertise, and all of that. And even some aggressivity on social media, and people have received threats for saying hydroxychloroquine doesn't work. And it's this atmosphere which is the hardest part of this pandemic, I would say.
Eva?
So I'm honestly a bit relieved that medicine is not my main topic, or not the topic of myself. So I feel I am reporting a lot about possible solutions like contact tracing and how to do that it works properly, or how to use artificial intelligence to help us with the pandemic, with finding out what measures are working and things like that. And I think that feels much better than doing this reporting about the basics and the problems and conspiracy theories and things like that. And in addition, I do many translations from Nature for German outlet Spektrum der Wissenschaft. And this helped me to be kind of really interested as well in that virus. So I find it really fascinating how that virus works and things like that. And what made me especially well, happy is maybe too strong, but optimistic is an article I translated about pandemics in the history of humanity. When I realized, hey, we are living in a good time actually, because we have science, we have all those people working on vaccinations and things like that. So I felt like in these other pandemics in human history were so much worse, and people were completely helpless and didn't know what to do. And so these things really help me to see the situation more optimistic. Of course, I do reporting as well on conspiracy theories and how the algorithms of social networks make them even stronger and more visible. And this is very frustrating. And I'm frustrated that this doesn't change at all over time. So there is a mixture of optimism about the future and pessimism about populistic people.
Malin?
What I really, there's some pros and some cons. What I really do like about this time is that it feels like science has gotten a better place in society, at least in Sweden. A lot of times I come to meetings with bosses at the news station, for example, and they ask me, what do the science say? What do the scientists say? What are the recent studies that came out? And I never heard those kind of questions before. Nobody ever asked me, well, what did the science say? Like that would be the big news of the day every day. And I think that this whole pandemic has sort of increased the interest in facts, in a sense. So I do really enjoy that part of the pandemic. What I find harder is more on a personal level. I have been reporting from elderly care hospitals where it's been the staff is very worn out. I meet people that lost loved ones, and I see a lot of bad things with the pandemic. And that kind of affects me personally, and it makes me rather angry. And then when I go out to report, for example, the other day I went out, they changed the regulations again to make them a little bit stricter, where it's actually more or less, it's not forbidden, but it's highly not recommended to go to shopping malls. So I went to a shopping mall and I asked people, what are you doing here? And I found myself, I like to be an objective reporter, but I looked at the tape afterwards, or we don't use tapes anymore, but I looked at the material afterwards. And I can hear how I angrily walk around, ask people, what are you doing here? Don't you know about the regulations? And sometimes I think it's important to stay objective as a journalist. And for the audience, it's kind of important that they are able to see that we are not here as, we should report more than being personally involved. And I think I've seen that many places, or scientific magazines, the Science, Nature, and are taking more or less political stance now. And I think that's something that we should try to refrain from. And I'm sort of talking to myself here because for me, it's sometimes difficult to do.
Okay, so I'm going to take a question. This is actually from a TV reporter in Spain, I guess your counterpart, Graciela, who I met in Lindau, I believe. So the European region of the World Health Organization is convinced that Europeans have pandemic fatigue. What is your opinion, and how can this fatigue affect compliance with the rules in the coming months? Whoever wants to answer.
Everybody, or so
everybody, yeah.
Feel this fatigue, and I'm not sure what the solution is at the moment. I think our politicians just tried, or they didn't dare to say this might take until Christmas or even until the end of winter or whatever. So they said this is just for November, and everybody was okay. I can do this for November. And now people are really tired of new measures, and it looks like it just gets stricter. It's really hard to say what the solution is, because I see, of course, the numbers in Germany are better than in Sweden, for example. They are better than in France as well right now. So it seems like it still works, and it looks like the numbers start not to grow, at least the last few days. But from the atmosphere and outside, just in the population, I feel like they are very tired, and it's hard to say what to do about that.
So in New York and other places in the United States, a lot of small businesses have gone under. Restaurants aren't doing as well because we limit the capacity. Is that happening in Germany as well?
So the good thing is that there's money from the government for restaurants and everybody who had to close, like gyms, restaurants, theaters. So they support them with some money, but of course not the same money they lose by just not earning money. But I think that helps many of them just to stay alive over the period of time. And I think that really helps a lot. We had a similar thing with freelancers in the spring. So I have some colleagues who could apply for some support from the government. Again, not as much as you would have earned in that time, but it helped you just to be able to wait until this is over, hopefully, and to go on with your business. And I think that's a big difference compared to the US. I had this discussion, funnily, with many colleagues in the US, because as well, what we do have is if people feel sick, they just stay at home. And if you're employed, at least you still receive money from your employer. And I think that helps, of course, as well with things like COVID, because people can afford to stay home when they don't feel well. And even if the company then has to reduce the work altogether, they still get money from the government so that they don't lose too much. So they work, let's say, only half time or only 20%, and they get up to, I think, 60 or 70% from what they earned before, so that they can just afford to comply with the measures in the end. I think that helps a lot. Okay. But of course, yeah, owners from restaurants are complaining a lot, because they did a lot of measures. They have new machines to bring fresh air in the restaurants and in gyms as well. They worked a lot and they invested a lot, and now they had to close again, and that makes them quite angry at the moment.
Yves?
Yeah, so I mean, restaurants and bars are unhappy and angry, and of course that's understandable, but there's not much one can do against that except from giving them some money, which the French government is doing right now, same as in Germany, less than what they would have earned. But I think the big issue is, it's not that, it's whether people will keep wearing masks, and whether they will stay compliant with, I mean, not throw crazy parties, and, you know, keep being careful, and how to get them to do that for several months to come. That's going to be a challenge. And my view, at least, I mean, the French experience, what I see in it is that the authoritarian way of doing it is not going to work for very long. I think we should be more in a sort of Swedish-like logic of explaining a lot and trying to convince people, especially because there's such a level of distrust in the government in France right now, for a series of reasons. I mean, public trust is really low. So whenever you say something is mandatory, some people will try and avoid it just because it's mandatory. And lots of these rules are only in the private sphere. So you can't really enforce them. So I would say that.
Okay. You're muted. You muted yourself. Okay, thanks.
Sorry.
Okay.
No, so just, I think there should be maybe less rules and more advice and explaining if we want to sustain this for several months.
Well, there are things that, I mean, in the United States, you have to wear a seatbelt. If the police pull you over, you're not wearing a seatbelt, you get an automatic ticket. People don't go through red lights because they know that it's a good way of getting killed. People do follow laws. People do, you know, sit down on airplanes. They don't walk around when they're not supposed to. So I think people can follow rules, especially if they're in their own interest. And so I don't quite buy that argument, to be honest. I mean, you know, you're trying to help, you know, you're trying to save your life, yourself from getting sick and other people from getting sick. So, but it is tiring. I mean, and also I think one other factor is that for the United States and for Europe, the pandemic was a spring event and a summer event, but now it's winter. It gets dark very early and it's cold and your options are less. I mean, to go outside and do things. So I had just a quick question from someone said, what is Sweden's policy about wearing masks? Malin?
The mask question is something that's really a hot topic in Sweden right now. It's not advised against. If you feel like you want to wear a mask, that's fine. And I've not started to notice, I take the subway to work every day, which is sort of a hazard in a sense, but I have no other ways of getting to work. So I have to go there every day. And it's not that crowded, but I see that some people are actually starting to wear masks on the subway now, in their own interest, in a sense. And I think that it won't be long until, if the spread continues as it is right now, the virus is actually increasing a lot, especially among young people in Sweden. I wouldn't be surprised if they change the policy into being a suggestion to wear face masks, at least in crowded areas, such as public transportation. I know in the beginning, they had this fear that people that are not used to wearing face masks sort of would touch themselves more in the face, for example, when they wore a mask. The science the science doesn't say anything about that. All the studies shows that actually you touch yourself less in the face if you have a face mask. So that argument sort of went away. And I think that there's not that much science saying that you actually that it actually helps you to wear a mask, but you actually protect other people in case you're asymptomatic. So I wouldn't be so surprised if actually the Swedish rules would change.
Well, in the United States, at least in New York, I mean, every state's different, but in New York, and you have to wear a mask on a subway, you have to wear a mask on a bus. You can't go into a store without a mask. And they're very strict about that. My laundry room, you have to wear a mask. So, I mean,
when it comes to masks, though, for us in Sweden, I think Germany is the example of how things should be done. It's always taken as an example of a good way of handling the pandemic. But my daughter was in Germany in the beginning of the pandemic, and she spoke about that. It's so much more, people are wearing masks, but it's so much more crowded, for example, in the subway. For us, it's actually, if the subway is full, people are not entering because everybody leaves to keep social distancing, except from the young kids. They are sort of not caring, but everybody else sort of try to keep social distance since we're not wearing masks. And that could be one reason to be a little bit hesitant about applying this rule. I think that people feel protected more than they actually are. That was one reflection after going to Germany in the beginning of the pandemic, that people sort of behaved differently. I don't know if that was just Berlin or if it is like that all over, but you could actually see that people were sitting really close to each other with their masks on.
okay. Someone asked, can we trust reporting of death counts from countries? Are death causes defined the same way in different countries, meaning patients dying of COVID-19 or dying with COVID-19, but having other causes of death as well? Do you know if these deaths are measured differently in various countries? It's kind of not an easy question for reporters to answer, I think. Anyone want to talk about that?
I looked into that actually a little bit.
Okay.
At least I looked into that it's been reported differently in Sweden in different ways. Okay. It's some people look at if you die with COVID-19, that is if you were tested 30 days around death, then it's counted as a death of COVID-19. And then we have a different way of measuring where you look at where actually a doctor has to say that the COVID-19 has to be the reason for the death. And that is a much lower number. So that's two different ways of measuring in Sweden. And I'm sure there are several other ways of measuring too. That's why I think this, when you start comparing countries and almost make it as like an Olympic Games of not killing people, that's kind of a different thing to do, difficult thing to do, because it's so hard to say what the numbers actually do mean. So that is a good question, I think.
Well, as you know, we have President Trump, who there's no national leadership on the pandemic. His followers are very defiant in wearing masks. He holds rallies with people, and then they get sick afterwards. and they spread it. But there are several Republican governors who are now mandating masks because the numbers are so bad in their state. But there's one in South Dakota who just refuses to do it. They have actually no rules, even though they have so many bad cases. So this is a question for Eva, since you report about security. So do you think that all the someone asked, are the campaigns and the misinformation, are they coordinated? You know, is there a group that's coordinating them? Are the groups working together, like Russian disinformation, that kind of thing?
So what I found out in the research, not especially about COVID mis and disinformation, but in general, is that these activities are often coordinated in the background, so that they have a Discord group, for example, and telling each other, so now this is the sentence or this is the hashtag we are going to use, and then make it big on Twitter or Facebook or wherever. And I'm sure this is coordinated. What I read is that right-wing extremists in Germany do spread misinformation about COVID. I know that there's a big movement against all measures or to protect civil liberties, which is really populist in parts as well. And they spread some misinformation about kids who were dying because they had to wear masks all the time. So they were dying, or one kid they told, or they spread in social media would have been dying because of not enough oxygen, which was completely wrong, but it was really a big rumor and many people heard about it. And there are still sometimes demonstrations in front of schools that people say the kids shouldn't wear masks at school, that this would be a problem, which of course, or as far as I know, is not true. That's not a problem.
It's absolutely not true. So, just like our president did lose the election, that's true. He doesn't admit it.
So
go ahead. Of course.
So there was this really there was a sort of conspiracy movie that came out in France 2 or 3 days ago called Hold Up, and it was entirely crowdfunded. At least that's what they said. They raised like 200,000 euros and did that movie. And it lasts over 2 hours, and it's just full of every single rumor that you can imagine and that drifts around the internet. And it's had an amazing amount of views. It was banned from YouTube, and then it was put on a private server, and it was still accessible and people still look at it. And it was pretty amazing because it sort of set the agenda of the media coverage. And, you know, the denialists have sort of been setting this agenda for a while, because every time they make this really particularly wild claim, and we have a tabloid kind of TV channel that will give these people the microphone and let them put these claims forward. And then everybody in the normal media sort of trying to answer and debunk these things. And that's why I'm saying they're setting the agenda, because even if nobody believes in the media what they say, we still have to spend time discussing it and debunking it. So I do have the impression that this is really sort of organized, and it's sort of systematic and long-term way of weakening society, which is quite worrying.
So do you know who Dr. Fauci is?
Yeah.
Okay. So that's our infectious disease expert he now has death threats, and Trump has a new advisor who says, you know, we got to take the power away from doctors. Now, doctors, of course, saved his life. Medicine saved his life. So usually when there's a national crisis or an international crisis, people kind of come together. But what I'm seeing is that there's great divisions. And I was wondering what we as science journalists can do to help that. Everybody.
So I think what you really missed for maybe even the last years as journalists is to stay in contact with our audience. So I feel, from my experience and the experience of many German editors, is if you really want to reach people who don't listen anymore to you, you have to meet them in person. So if I have neighbors, for example, who are really skeptical of the media or people I just meet somewhere, it helps to talk to them in person, and then they see, oh, okay, this is not whatever, the bad media with bad intentions, or maybe so they don't write what the government wants them to write, things like that. So to show them how we work and to make it transparent. And I think this really didn't happen for the last years. And I think this is one of the reasons why there's a really growing populist movement. I saw this when I was in the US, and I think that's, of course, the problem is much bigger than in Europe so far, but it's growing in Europe as well. And I really think we have to start talking to the people again. And although, of course, this is tiring and hard maybe, but I don't see another solution, honestly.
Malin?
I agree with Eva that you have to sort of talk to each other and invite people that don't have the same beliefs. What I try to keep in mind, even as I said, that it kind of makes me sort of angry the way people some people do not care about the regulations and behave badly in a sense that really gets to me. I try to at least talk to people and hear the best arguments. And I think that's when people are worried about something, we as science journalists sometimes are so easy to just call them stupid and to laugh at people that have a different belief. And especially when it comes to a big question right now, the vaccine, when it comes, 1/3 of the Swedes says they do not want to take the vaccine when it comes. That is a huge part of the population. And I hope that they will change their minds when we do get the vaccine, because otherwise that will be a big problem. But I think a better way is to ask what are they afraid of, instead of laughing at them and talk down to people. I think that's an important way to handle this.
Okay.
So I agree with what's been said. I'd like to address a sort of sideline of this, which is the quality of the work that journalists produce. I think at the beginning of this pandemic, many media were absolutely not prepared. I mean, many important media didn't have a science reporter in their staff. Some major French televisions, they had vaguely one health reporter, and they sort of found themselves really lost with what was happening. And I think, and I agree with Malin on this point, there is a thirst for science. And maybe this is sort of an opportunity for science journalists. And I certainly feel that in my association, we've had calls from TV channels saying, can you provide some training for our reporters, because we feel we're just not up to the job. And I've had many calls from media who just said, show me a good science journalist who's available, because we need people right now. And I think this would be a sort of moment where science journalists associations and the profession as a whole could push for more scientific training, more room for science journalists in the media, more responsibility for science journalists in the media, sort of pull them out of the ghetto and, bring them closer to where the decisions are made and where the front pages are decided and all that. And I think if the media coverage improved in quality, that would also be a way of being efficient against disinformation.
I remember at a meeting in Lindau, we were talking about this very issue, and this one Nobel Prize winner saying that, people believe in science. Some people deny climate change, but they want their elevators designed by engineers. They want their cars inspected. They want their airplane pilot to have had more than an hour's training. So they do believe that, that there is a value in having quality and science and those things. And he thinks that's one way of doing it. I mean, you want your pandemic expert to actually be an infectious disease specialist rather than just a political hack. But I think as scientists, we really need good communication from scientists as well about the pandemic and people listening to them. I mean, the 1968 pandemic, the Hong Kong flu, the SARS, we didn't have politicians, talking about it, making up their mind. They just had scientists go up and talk and say, this is what I know and this is what you should be doing. And people seem to be more respectful of what science had to say. And I think scientists, it's not. I mean, now people are actually just arguing about facts. So like, arguing that, and they always point out the virus doesn't care whether you believe in it or not. Doesn't care if you're a Democrat or Republican, if you're a socialist or a right-wing person. It's looking for a host, and it doesn't care if it's Christmas or Oktoberfest or any holiday. It's looking for a host. The other thing is that one of the very sad things is that, throughout plagues, people are dying alone because, people didn't have enough equipment, as Malin said, to actually go into the hospital. So families couldn't go in. During the bubonic plague, you couldn't go near a person because people got sick from dead people because the flies would jump from the dead people to the people visiting. And so there is a real tragedy in this pandemic that people are just not really taking it seriously enough. So I don't, it's late. I know it's late for you in Europe. It's 6 hours difference. So I'd like to hear some closing words from you and what are your plans for, what are you going to cover next? So Yves, we'll start with you.
That's great.
Sorry.
You're muted, Yves.
He said, Yves, it's you.
Okay. I'm sorry.
Am I still muted? No, I'm good. Well, I don't know. I think this question of, what I'm still working on this question of the origins of the virus, and I think it's a really interesting thing that might develop quite a lot maybe in the future. As closing thoughts, I would say that there is a lot of curiosity right now. People have made incredible progress on what a virus is. Nobody knew what a virus was only 6 months ago, and there is really a strong curiosity and some sort of scientific culture that has come out of this. And I think that if the whole media machine sort of understands how valuable talking about science is and how people get interested in it, then maybe we will have made some progress to tackle other issues such as climate change and biodiversity and other stuff that we need to talk about as well.
Malin?
I was thinking what will be my next story. I think that I'm going to work some more about the testing. I still think that is a very important key factor to stop the pandemic. Right now, Sweden is right now at a breaking point, tipping point again. It seems like our numbers are increasing too fast. And I heard some doctors saying that we're only 2 weeks away from where we were this spring. I hope they are wrong. And I'm sort of hoping to be able to report on the vaccine very soon. That's what I look forward to. And I hope that what Yves says about this being a good time for science is true. Then at least something good would come from this pandemic.
Eva.
I was thinking a bit about what you said last, David, about people who don't take the virus seriously. And I'm not sure, of course, there are people like maybe Trump and his supporters who saying things like this virus doesn't exist or it's it's only like a flu or something. But at least in Germany, I see the bigger discussion is on people and our values and which measures we should take to fight the virus. So, for example, schools are open, although of course the virus is spread there as well. And this is again a difference I saw to the US when I was there in March, April, May. Our kids were as well, of course. We had to homeschool them, and I know in Germany at that time there was homeschooling as well. But I really saw how many kids in the US were just the teachers didn't reach them anymore, right? So the kids who didn't have technology, who didn't have parents who care about making them joining the remote teaching, they disappeared. I even saw that in Cambridge, which is a rich city, right? That just kids from families with less money, but just disappeared from the teachings. And I think this is a big and discussion, and it's important to talk about these things. So what are our values, and what are we open to risk? So of course we risk something by leaving schools open. We could just close them, and I think the best thing would if just everybody would meet nobody for the next 3 weeks, but this is just not possible, and I think this conflicts with other values. And I think this is a discussion we should, I think, as Malin said, we should be open towards arguments for even for of course there's this civil liberties and that contrast with some of the measures, and I think this is an important discussion, and we shouldn't be too arrogant about that. And I don't want to say that you were arrogant, David, right? Please don't understand me wrong. Okay. And next story I'm going to work on, I see some discussions in Germany, and especially in my scientific filter bubbles in computer science, that start to think about if we should trade off privacy and data protection against personal freedom. Because of course we see that countries like South Korea handle the pandemic pretty well, and they have much more personal freedom compared to us at the moment. But they, of course, they have less privacy and less data protection. And I think this is really interesting to think about. At the moment, I would say, no way, we cannot give up data protection and privacy, but maybe there's a way to make it, with the help of technology, to make sure that this is only for a certain amount of time. Maybe we could create something like, or a scientist could do that, like self-destroying data after some time, that you can use these data really only just for this one use case, for whatever contact tracing in that sense. And this is something I want to research, if there's maybe help from technology to deal with this problem, the trade-off between privacy and personal freedom.
So so we have a few minutes. I just want to touch about the vaccine. So I've noticed that the lines to get flu vaccines are, I mean, you have to make an appointment to get a flu vaccine, and the pharmacy said, I'm doing this all day long, giving flu vaccines, and because people are very scared. I mean, when I worked at the Lung Association, someone said, well, how do we get people, because people getting flu vaccines is usually like 50%, very low, just like hand washing, which after all these years is still very low. And someone said, how do you get people to get a flu vaccine? I said, announce there's a very big shortage, and people will be clamoring to get the flu vaccine. So when people ask me about, they said, well, I don't want to be the first to get this new vaccine. I said to them, you're not going to be the first, because there have been 50,000 people in different studies getting them. And also I said, well, the rate in New York City is now, the infection rate is 3%. If it's 99% in New York City, would you get the flu vaccine? Would you get a vaccine for COVID? He said, oh, I would definitely would. I said, well, how about 75%? He said, I would definitely get the vaccine. And I said, how about 50%? And they said, well, then I'm not sure. So it's really, it all depends on people's risk assessment. So how are we going to encourage people to take the vaccine when they're approved, and when they're proven in their published studies instead of press releases? Any ideas?
I think one important mistake that we usually make is that, at least in Sweden, we had with the last pandemic with the swine flu, we had very unfortunate side effects. So people got narcolepsy. I'm not sure what the English word is when you fall asleep all the time.
Narcolepsy.
Yeah, that was something that a lot of, especially young children in Sweden, got from the vaccine. And we did a lot of stories with, it was horrible stories with these small children that got their lives ruined. And sometimes I think we should do more stories with the same urgency, with the same sense of feeling when it comes to not getting a vaccine. You're not actually getting a vaccine for yourself. You're getting it for your grandmother or for people you love, for everyone that could be killed if you are actually not getting the vaccine. Sometimes I think we focus too much on numbers, and we should focus more about feelings, even if you are pro-vaccine.
I think it's a good idea. I mean, that's what we say about masks. You're wearing it not for yourself, but for others. Eva, any ideas?
So what Malin said, I think this is interesting. And actually, I see many of these stories in Germany from whatever kids who had to die because they were infected with measles from whatever in their neighbors or whoever. And these kids were maybe too small, or they had preconditions and weren't able to be vaccinated. So I think we are doing those stories, and maybe this is my filter bubble, but I don't feel that this is such a big problem. I feel like the risk patients or people who really don't want to get COVID are really open towards a vaccine, and those are the ones who should get it first. So I'm not sure if this is such a big problem, but maybe I'm wrong.
At least in France, there's a really big distrust of pharmaceutical companies. I think the transparency issue here is super important. We really have to get that data and to get the unwanted effects data. And, people must know exactly as much as possible what the risk is, and they must have the impression that no one's hiding anything from them, and they must have the impression that no one is profiting from them. And we've already seen two pretty bad things right now with Pfizer, putting out this press release, and then the shares go up, and then the boss sells 5 million worth of these shares before they go back down again. I mean, if stuff like that happens, and there's also a deal between Gilead and the European Union. They signed a deal before the data of the efficacy came out, and the data was not good, but the deal was already signed. So, I mean, this kind of thing is really, really bad for vaccine acceptance. And we should be very demanding on what Big Pharma does and how we report on it, I think.
Okay. Malin?
Did you want me to say something about that too?
Well, what are people excited about? I mean, people in the United States were very excited about the fact that there's a vaccine.
Yeah, people are excited, especially the elderly people are.
Yeah.
But I hear a lot of young people say, well, it doesn't matter for me because I know at least 20 people that already had COVID-19 and nobody got sick. It's not that big of a deal. And then you sort of think about getting a vaccine to protect yourself. If you would have a better understanding on how a vaccine works, then maybe these people that hesitate to get the vaccine because they don't need it sort of would understand that they kind of have to get it to somebody else.
Well, we have Governor Cuomo, who's he did a daily broadcast, and he would talk about his daughters and his brothers on CNN, and he would say, "Don't go visit mother, or don't go visit grandma." He said, "Don't kill her." I mean, he would make it very personal. I think that was some of his success. I think we need more politicians like that who give those examples. But he himself said that he's not going to allow the vaccine until his own independent experts certify it. And of course, we had President Trump saying he wouldn't give it to New York, but Pfizer is headquartered in New York City, so I don't think it's going to be that big of a problem. So anyway, I want to thank my guest, Eva, and Malin for agreeing to spend time with me on a late night for you. And I hope you and your family stay safe. And hopefully by Christmas, although I guess nobody wants Santa Claus coming down the chimney because he's no outside visitors and going from home to home. But it's been great seeing you, and I'm sure we'll do this again at some point. So
thank you so much. It was interesting.
So, yeah, so we're taking a break for next week because next week is Thanksgiving in the United States. That's a holiday for us, and there's big debates on what to do and whether you should have a family gathering or not. You don't want to kill your parents or your grandparents.
And how is it? Do people meet their families? Well, because as far as I experience, Thanksgiving is really bigger than Christmas, right, in the US. So what are people doing? Do they stay away from their parents or do they visit them?
Well, everyone's bargaining with themselves, saying they might just visit their parents, but Dr. Fauci announced that for the first time he's not going to be with his kids, and the Francis Collins also said, and he said we'll do it next year. He said, or you do it through Zoom or something like that. Yeah. He said it's not, and you don't want people. I mean, if people travel, on a plane to see you, that's not a good thing either. So I don't know if Thanksgiving is bigger than Christmas, but it is a very big holiday, and that's where families get together and stuff. But it's also, they said, the biggest spreader is indoor gatherings.
Yeah, family events, especially in Germany. Events. We learned that family events are really big, super spreader events often. Yeah.
Yeah. So that stupid cousin of yours who came. Okay. So, anyways, so thank you very much. Stay safe, everybody, and I'm sure we'll do this again. Take care.
Thanks a lot. Stay safe.
Bye-bye.